Patients with heart disease often suffer from long-term debilitating chest pain, especially when their disease is complex. Treating these patients isn't straightforward. VP Med is dedicated to accelerating the adoption of medical technologies to advance patient care, providing education to the whole clinical team and supporting clinician development.
At the heart of any medical procedure or decision is the patient.
When you're in that room and you're fighting for the life of that patient, you want to have confidence in your own ability.
When it comes to heart disease, biotech innovations are offering clinicians an increasing number of options.
For example, balloons that transmit ultrasound waves to crack hardening within the wall of the artery.
That does come with challenges of its own.
Any new technology is going to require a new technique, and any new technique is going to require teaching in order to get that maximum patient outcome.
It's why VP Med goes above and beyond as a distributor, from stress testing products to demonstrating how they work.
The language an engineer speaks will be highly scientific, highly technical. The language that our healthcare professionals use is very clinical and very technical. When you reduce language down to its raw components, you arrive at the base principle of why was this made, how is this product best used, and how can we get the best for the patient? What training do our healthcare professionals need in order to understand this?
So this is an example of the type of materials that VP Med provide for us to help teach doctors how to use equipment. They provide suggestions for the tools to use at each stage of the procedure, and then they show you in the bench models how to use those. So you get your hands on the devices themselves, see how they perform. So you can see we've got a model of the heart here.
In essence, VP Med helps the people who help people.
Now, I've been working with VP Med for over 15 years, and they've been really altruistic in the way that they've supported our educational ambitions.
Listening to the teams that we're getting involved with, hearing what their struggles are, hearing where they would like input, and being able to tailor make that to suit them is what I love about it.
They will come with their models, with their simulators that they've been developing, but also with their visuals, which are really important for trying to get across concepts of how to treat disease.
From the way they prepare PowerPoints to the animations that illustrate exactly how a piece of tech works, no detail is spared. You can tell the CEO is a graphic designer. That not only lent itself perfectly to educating professionals about medical technology, it's also set an industry standard. Adrian Brown's vision of enterprise by altruism feels very at home at their castle headquarters in the West Yorkshire countryside.
He'd spend time on the wards and just saying, do you get this? Does this make sense? You know, what we've been provided from our manufacturers and thus passed on to you. And every single time you asked the question, could this be clearer? The answer was yes. And it was from that point forwards, education had to lead everything we do.
That education goes beyond physical tools in VP Med's Impactful series. We
have impactful presentations to help people design clear, visual PowerPoint or keynote presentations to give at conferences or to give in their offices, to give in board meetings.
And then you might see them on a stage at a conference, at a lectern, and their passion comes across as they're talking. What they're doing is then inspiring the next generation who will be there to deliver education.
It always comes back to the heart of the matter.
Everyone's there to get the best for the patient, because it could be any of us next. It could be me, it could be you, it could be one of our relatives, it could be a best friend, it could be a kid, it could be anyone. So I think when you start on this altruistic plane of trying to do best, the people we work with in the clinics identify with that. We have to act in synergy, we have to act in collaboration, and that's it. To help the people, we have to do it this way.